We are delighted to have Dr. Neela Gandhi with us today in our studio. We are going to talk about dental challenges and dental health with her. She has been practicing dentistry for the last 20 years. Dr. Neela Gandhi, welcome to our studio.
Thank you, Pendraji, for having me. It's a delight to be
Sure,
here.
welcome.
Yeah.
Before we talk about other basics about the dental hygiene and dental health, let us first start with what are some of the major dental health issues which we face?
There are a couple of things. One of the things that I think that is very common, and that's where we start, is the gums. The gums are the foundation of our teeth, and so it's very important to have healthy gums. So it's important that you know how to keep your teeth clean and your gums healthy. Otherwise, you can get gum disease, which can progress and get to a level.
So, for example, like when I come as a patient or somebody wants to be looked at my teeth, as a dentist, what are the first things you really look for?
Well, we do look at your general overall mouth conditions. We look at your soft tissues. It's very important that we just don't look at just the teeth. We do an oral cancer screening that's made part of a routine dental exam. And then we look at your gums and make sure they're nice and healthy and advise you accordingly. And then we look at the teeth for any cavities or any other problems.
So, what type of problems we might have in teeth, for example?
So, couple of things. If you are, if you haven't been to the dentist for a while, or if you eat a lot of candy and or drink a lot of soda, you can get cavities in your teeth.
What about chocolate?
Chocolates too.
True.
Are, it's actually the frequency of sugar that is bad. It's not the quantity. So it's funny that if you brush your teeth after eating sweet, you are actually preventing any tooth decay.
Good to know.
Yes,
Sure.
yes.
And so the sweets is one. What are other precautions?
Other things that are very common, especially in the younger age group, is soda. That actually is known. The acid is known to wear off the enamel and causes thinning of the enamel, and so that's also not very good for your teeth.
So how many chocolates or how many times sweets we are allowed to eat?
Well, we actually recommend if you can limit them to meal times, which is always more difficult. But like I said, if you can just reduce the frequency and anything, like with anything, everything's good in its limits.
Now, so let's come back to the different type of teeth problems which we can have.
So
cavity is one, right?
Correct. You
Okay.
can get sensitivity of teeth. If you brush your teeth very hard, you can wear down your gums. You can cause thinning of the tissue. So sensitivity can come from that. If the cavities are left very long, they can expose the nerve, cause tooth pain, and then that can lead to other problems where you may need a root canal. You can also have, some people, it's becoming very common because of the stressful lives we lead. They actually end up clenching or grinding their teeth. So there's a lot of wear on teeth, and that can lead to, we see actually chipping of the enamel near the gum, and that can also bring other problems like sensitivity. So that needs to be prevented as well.
Now, how important it is to visit make routine visits to dentists?
It's very important because we recommend at least every 6 months, twice a year, because there is that general thing that, oh, I'm not in pain, or my teeth are fine. But it's very important that when you do go to the dentist, you make sure that you prevent any problems from getting out of hand. So your dentist visit is very important to make sure that if it's something small, it can be addressed at that time.
Now, as a dentist, I'm sure that you see the Indian population as well as the non-Indian population.
Yes, I do.
Do you see any difference in the dental care among the Indians, South Asians, and
One of the things that I have seen, especially in South Asians who've not been here that long, is that there's more prevalence of gum disease leading to periodontal disease. They're not prone to getting so many cavities, but we find that because growing up back in India, we are not very, we're not brought up with that, the importance
sure.
of going to the dentist every 6 months.
Sure.
So by the time you go to the dentist, you've actually got some gum disease or bone loss, and so we have to. Some of it at that point is irreversible. So that's where we see a little more prevalence in the South Asian community.
Now, in today's modern era, in look and feel good, I think the eyes and teeth, these are two very important part of how we look.
Sure.
And teeth is definitely very, very important. And now we also see that there are a lot of products in the marketplace to keep your teeth shining white and all this stuff. What is your take on those products? How good they are?
I think they do make a lot of difference. A lot of people, like with it's not just the feel good factor is part of having a beautiful smile, and so people do like to have nice white teeth, bright teeth, and so there are products. There is over the counter and in office products as well. There are some over the counter products that work. That are not bad and do have some improved, some positive effect on whitening. But generally, like with anything, the professional whitening when you go to your dentist are more effective because they're only dispensed professionally at your dental office.
Now, talking about this white teeth, I have noticed that, some people have the teeth which are naturally very white and bright. Some people have, aloe and all. Is it because they don't care, or this is how the structure of the teeth is?
Well, one of the things is that with time, teeth do stain from every day. If you drink a lot of tea, coffee, drink wine, there's more tendency for them to stain. There are also medications out there that, depending on where you are brought up, also in the fluoride concentrations of water does affect the development of teeth. So things like tetracycline is known if, you were given that while, you were growing up, that has got a natural tendency to cause a stain, which is not easy to take off with just the whitening products. And so there are other things. Generally, people, who do go regularly to the dentist and do have, brighter teeth, because when you do visit your dentist, they polish the teeth and clean them, so they are whiter. But nothing really so much in the development of the teeth. That's, I guess, when the teeth are developing.
Okay.
Yeah.
Now, also I have read and heard is that teeth can be also an indicator of various other diseases which we might carry with us.
Yes.
Is there a link there between these teeth and other diseases?
Yes, very much so. The importance of oral health is very important for your overall health. There's been links between generally people who don't have good oral hygiene tend to have a higher risk of diseases like stroke and heart disease, because what's been found, research shows that plaque on your teeth eventually finds its way, in your bloodstream and sticks to the arteries and can lead to stroke and other heart conditions. Also, there's some studies being done with a link between heavy plaque buildup and lung disease, and also diabetes, which is also prevalent in the South Asian community, it's noted that there is a risk of higher periodontal disease and more risk of infection to diabetics in the oral cavity and vice versa. So it's important that diabetics, maintain a very good oral hygiene.
So is it because of does diabetes also impact the teeth, or it's the other way around? Or
It's both. It's correlated, yes. Okay. Yeah, because generally people who have uncontrolled plaque and oral hygiene have also risk of higher sugar levels. And same thing with diabetics who are uncontrolled sugar levels will be seen to have more risk of periodontal disease.
Now, what are the three things we should really avoid in order to have a healthy teeth? Well, healthy teeth and gum, I should say.
I think one is you must, limit your sugar intake to meals. And you must, I think it's important if you can visit your dentist at least every 6 months to make sure that we're looking after your teeth. And I would recommend also, it's very important not just visiting the dentist, your home care is very important. Brushing your teeth twice a day and flossing your teeth also all add to good oral health.
Is any difference in taking care of the teeth among the adults and children and people who are seniors, or the same?
I think there is a difference. I think with the children, there is that transition where they are learning how to brush. So when they're under 10 years, they need help with their parents helping them make sure that brushing, because generally a lot of children find it like a big difficult task to brush their teeth in the morning. So parents guiding them at that age is very helpful. As you get older, it's important you make sure that you are brushing correctly, the technique is correct. With the seniors, there are certain challenges like, if they have arthritis, they have difficulty in holding toothbrush. So there are other things, and they need a little more care as far as, as far as taking care of their teeth. And, if they're wearing dentures, they need to know how to take care of dentures as well. So
now, every time we visit, at least when I visit the dentist, she always tells me that, Mr. Mishra, keep what do you call the thread?
Flossing.
The flossing. Keep flossing,
Sure.
Don't floss enough.
Yes.
And I find flossing very, very tough things to do.
Sure.
Is there any substitute for flossing?
You know what? I recommend my patients. There are a lot of aids out there that made it very much easier. I know some people find it hard to wind the thread and go through. So they are like flossers, we call them. They have a handle, and those are so much easier to use. And so there are a lot of aids out there that are easier to use. But one of the tips I give my patients, which actually works well for me as well, is I find that one of the things that, when we always keep telling our patients, you're not flossing enough. They do their twice a day brushing, but they're not flossing enough. So I do tell them that, if you keep your floss by your TV, and that's one of the times you are, you have some downtime for yourself. So, you're a little more relaxed. And it takes just 2 minutes. And, if you can just work your way around the teeth, it's very helpful. And, if you can't do it every day, at least a couple of times a week would be very helpful.
Now, this is very common, I find, in the Indian population. I'm sure it must be true for other South Asian population as well. The issue of a wisdom tooth.
Sure.
And, many of us have the wisdom tooth. And again, each time you go to see a dentist, they say, oh, you need to take the wisdom tooth out. How important is it to just keep it, leave it there, or take it out?
So wisdom teeth are one of those teeth that come through in the mouth if they do a little later in your growth phase. They generally tend to come through in the mouth when you're about 18. So what happens is that because they're the last teeth to come through in the mouth, sometimes there's limited room for them to come out. So what happens is if there's enough room, they come nicely and you can stay with them like just the rest of your teeth. If there's not enough room, they sometimes grow at an angle. Sometimes they're buried in the bone or they're partly through. So the biggest issue comes when they're partly through in the mouth, because what happens is when they're just pointing through the gum, there's a tendency for you to have difficulty brushing back there. So there's tendency for it to get infected. And so if there is a piece of gum covering them or if they're just partly poking through, they do end up causing problems down the road. So those are the ones that we really recommend taking out. If they're buried in the bone and they are not, going to be any issue, we recommend leaving them alone.
Is there any particular age that it must be taken out by?
Well, the younger the better, but it's not a problem even if you do take them out. The main thing is you've got to check the position and make sure that they're not very close to the nerves, and so there is no other issues that would arise in taking them out.
Now, when the dental situation becomes an alarming situation that I should really seriously see a doctor, what are the symptoms for that?
Well, one of the most common things that we find that with people who've not been to the dentist for a long time is they have bleeding gums, and they have the gums are very inflamed, and when they brush, the gums bleed, and that's a sign that there's not good plaque control. So that's when you really need to see the dentist. And it is very important, because what happens is if that is left alone, it's not just the inflammation, it does slowly progress to loss of bone, which holds the teeth. So what happens is that if you leave that too long, the teeth become loose, and you have eventually loss of your teeth, which is not good. So that is why we recommend that you shouldn't wait until that point.
Yeah. Now, two more other things.
Sure.
We cannot talk about dental health without talking about root canal.
Sure. Yes.
So tell us a little bit about root canal and how painful it is.
Yes, so everybody, we do hear all the time that, people are very nervous about when they're told that they need a root canal. So a root canal is actually a treatment that is like doing a filling, but it's doing a filling in the root. So what happens is when you have a cavity and the cavity progresses until we have the outer surface of the tooth is the enamel, and then you have the middle surface is the dentine, and the inner surface is the nerve. So as the cavity progresses to the nerve is when you start having pain. And that's the time when once the decay has reached the nerve, it's at that point where the nerve starts getting necrotic and gets infected. So at that point, you cannot really do a simple filling. You actually have to take away all the dead nerve and the infected nerve. And that's what part of the root canal involves. So you clean out all the dead nerve from the canals and just fill the root.
And that's where the root canal, the word comes.
That's the way the root canal word comes.
So Neela, one more thing we want to talk about is mouth cancer. And of course, cancer is very scary. And so what are some of the symptoms of mouth cancer, for example?
You would typically get lesions in your mouth, sores. It starts as a sore, which typically when you go to your dentist and you see lesions that are suspicious,
So
especially
they happen on the tongue or on the...
it's actually, it could be
Kind-
anywhere.
anywhere, okay.
Yeah, there is tongue, cheeks, floor of the mouth, tonsils, palate. They do can occur on all those places, and generally we find that it's the symptom is more like if it's progressing a sore that is lasting more than 2 weeks is when we start getting a little bit suspicious and make sure that it's not anything that is leading to a cancer.
Is there any market research or data that what percentage of population of cancer is oral cancer or anything? Yeah.
I think I know that by 2015 we're going to have about 43,000 Americans would have been diagnosed with oral cancer, and they say one person is dying every hour a day.
One person.
Yes.
Okay.
So it is very important.
Now, it is curable or
Yes, yes, it has a good treatment as long as it's diagnosed early. Yes,
Okay.
and that's why it's very important that early detection is made.
Okay. Talking about detection, last year at our health expo, your team did an absolutely fantastic job of dental screening, and I think it was we had more than 100 people or so came for
That's
dental
right.
screening.
Yes.
And you're going to give the same service to the community this year as well. Do you plan to do anything new this year or new machines or anything?
Yes, we have. We do put a lot more emphasis because April is Oral Cancer Awareness Month.
Excellent.
So it just coincidentally happens to have the expo. So we are very happy to be part of the expo and be able to offer the oral health screenings to the community. And we did have a very good turnout, and we are hoping for better this year. And we do have, in addition to just using visual aid oral cancer, we have some great devices out there and which use fluorescence mechanisms to see if there's any areas that are suspicious, and so we will be having those a couple of those devices at the expo to use for the oral cancer screenings.
Yeah, excellent. Now, the last question I'm going to bring back you to again Indian and South Asian population, and those of us who were really not even taught, to go to the dentist, and this concept didn't exist there. And after being here, still we fail to take care of our teeth. What are the couple of advice you will give to them? I know you said that visit a dentist and all those things,
Sure.
but anything else we can do at home?
Yes, I think there's a lot you can do at home. I think just basic things like brushing your teeth twice a day. If you can floss a couple of times a week, even if not every day. And, that should make, you want to make sure that you're doing it correctly. So, there's a lot of help out there. I would really suggest, reaching out if there are any questions, and reach out to your dentist, and I'm sure they'll be there to help.
Excellent.
Yes.
Neela, thank you very much for coming.
Thank you, Penterji, for having me. It's
really
been a pleasure.
enjoyed talking to you and
Yes.
learned a lot about the dental health.
Great. Thank you for having me.
Excellent. Good. Welcome.